Hi, welcome to another episode of Hot Takes. Now, when someone on the far left accuses someone who's even more extremist left of betrayal, of going back on the very essence of what it means to be a Labour politician, you know things are not well at the heart of the Labour Party. But what you've got now is the likes of Jeremy Corbyn, who's now accusing Keir Starmer of betrayal of the NHS. He's saying Starmer is not living up to the Labour ideal, he is not looking after the vulnerable in society, and he is actually a terrible leader. And boy, when it comes to terrible leaders, you've got to say Corbyn knows what he's talking about. He, until now, was the worst leader the Labour Party ever had. All of a sudden, he looks like a towering genius in comparison with Starmer. But he's saying that the health service being pushed into the private sector by hiring private sector employees and doctors and nurses and facilities and resources in order to prop up the NHS is an absolute betrayal. He says the money should be put directly into the NHS, not being used to pay the salaries of private medical personnel. I don't know what the opinion on that is with the good people who are watching this video. I think anything that helps reduce the waiting lists, regardless of how it's done, has got to be a good thing. And if you have the resources available to utilise private medical care, then utilise it, but don't make it a long-term thing. Just use it to get the waiting list down. Not from 18 months, not to 18 weeks, but to less than 18 days. It should not be any longer. Bring the standard of care in the NHS up to the private level. Do that, and there's no need for private medical care, of course. The one reason you've got so much private medical care is because the NHS is falling apart, and even when it is working, it's still terrible. It's one of the big major interventions that Corbyn has made on this issue. Normally, of late, he's been concentrating on the Middle East. He was in London the other day, was Corbyn, and he was being pestered by people asking him awkward questions that he did not want to answer, and then just kept walking away and had his mind as protecting him because he's not capable of answering the very awkward questions he was being asked about. Are you going to fight to get the hostages back, etc.? What are you going to do when Donald Trump says that day one of his presidency, he's going to sort out Gaza, and he says it's going to be a bad day for Hamas? I don't disbelieve him. He says he would rather see the Middle East burn. This is Trump said he'd rather see the Middle East burn than allow the likes of Hamas to succeed. I mean, and you've got to believe Trump, haven't you? Mind you, Trump's got a lot on his plate on day one. He's got a lot of things he wants to do, so he's going to be a very busy man. But anyway, Labour leader announced on Monday, this is Starmer, announced back on Monday that they were going to avail themselves of private medical care in terms of pushing NHS patients into private health in order to bring down the waiting lists. He said that. So that'll be public money paying private healthcare. I wonder if that will apply to immigrants predominantly, one wonders. But it is a significant, a major expansion of private healthcare into the NHS. Now, for years, the Labour Party, of course, have been saying that that's exactly the sort of thing that, that the Tories are going to do. They want to privatise it. And the Tories have never, ever privatised the NHS. The only people who have were Labour. When Labour sold off one NHS hospital and turned it into a private hospital, and then thought it was such a good idea, they did it a few more times. If anyone is privatising healthcare, it's Labour, despite all the bullshit they come up with about caring and about being the party that protects the NHS. They're not. Evidence is clear. The NHS is in danger under a Labour government. And it's always backed up and pushed up by the Tories. The reason is everyone perceives the Tories as being the terrible ones, and so the Tories go out of their way to actually put even more resources into the NHS to try and obfuscate this. But the truth of the matter is, if you want a good NHS, you need a Tory government. Labour are the ones destroying it and always have done. Anyway, under these plans that he announced the other day, 2.5 million, that would get you about a day's work, wouldn't it? 2.5 billion extra is being pushed into the NHS for use of private medicine by the health authorities all over the country. So they'll have this amount of money that they can take, particularly the ones that they know they can get through quickly, and they'll bung them all through and put them off into private hospitals in their area. So, the likes of a Bupa or a Three Shires or a Viva or whatever the particular supplier is, will get an extra bit of public money thrown their way. Very nice, I'm sure. Taxpayer paying for it. But, and this is the bit I'm sort of in the middle of, while I like the NHS, it is terrible, and I want the NHS to be brought up, I do appreciate the fact that you need to do something to reduce the waiting lists. But going forward, you need to get the NHS waiting list down to days, not weeks. It can be done. It can just simply be done. Privatise the whole of the NHS. Make it all private, paid for either by cash, credit card, private insurance, or national health insurance. Taken out of your salary. And you have different care levels, I'm sure, but you got that anyway now. But run everything as a private hospital and get the efficiencies, because private hospitals look to make cuts where they can in non-essential staff, such as the managers that manage the managers of the managers, and you don't have paperclip managers and rubber band managers that you do in the NHS. Ask anyone, ask any medical person in the NHS about the problems of management, and they will tell you that it's a major problem. Apparently, during the COVID days, so many managers worked from home and just weren't there interfering on a day-to-day basis, that the NHS actually became so efficient that waiting lists shrunk. That should be telling. At the height of the pandemic, waiting lists in hospitals shrunk because all the managers were at home. Let's take that and run with it. Now, of course, one of the big problems you're going to get accused of with what he's planning is that the private companies will cherry pick the profitable work. That's fine. I don't care. They're going to do that anyway. Let them cherry pick it, because every patient that they do is a patient not on an NHS waiting list. It frees up a consultant. It frees up an operating theatre. It frees up something else. So let them cherry pick all the nice stuff that they can make a bit of money on. Don't care. Get rid of the waiting list. Make it better for everyone and move forward. But do not get away from the fact that this is a Labour policy, and it's Labour privatising the NHS. Thanks very much. Take care. Speak to you soon. Bye.